Which of the following is termed as respiratory function indicator? A. PO2. B. PCO2. C. Saturation. D. Bicarbonate ion. Acid-base imbalance that develops in acute renal failure is A. Metabolic acidosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic alkalosis. Hypoventilation leads to A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Each unit of blood transfusion can increase the Hb level of A. 1 gm per deciliter. B. 1 mg per deciliter. C. 2 gm per deciliter. D. 2 mg per deciliter. Which of the following electrolyte imbalance is seen in massive blood transfusion? A. Hypokalemia. B. Hyponatremia. C. Hypernatremia. D. Hypocalcemia. Which one is used for the treatment of hypoproteinemia? A. Albumin. B. Prothrombin. C. Globulin. D. Sodium. If the blood bag contains gas bubbles, it indicate A. Bacterial growth. B. Fluid overload. C. Hemolysis. D. Rh incompatibility. Which of the following is an example of isotonic solution? A. Half NS. B. RL. C. 10% D. D. DNS. Myopia can be corrected with A. Convex lens. B. Concave lens. D. Adjusted convex lens. C. Cylindrical lens. The cells of the pancreas which secrete insulin is A. Gamma. B. Chief. C. Beta. D. Alpha. Carpal tunnel syndrome is caused by A. Pressure on cephalic nerve. B. Damage to lower motor neuron. C. Pressure on median nerve. D. Injury to wrist joint. Which disease increases the chance of fractures? A. Tetany. B. Gout. C. Osteoporosis. D. Crohn's disease. Koplik spots are seen in A. Convalescent period. B. Prodromal period. C. Incubation. D. Eruptive. Drug labeled as 40 milliequivalents in 20 milliliters, 30 milliequivalents to be administered. How many milliliters to be infused? A. 10 milliliters. B. 15 milliliters. C. 20 milliliters. D. 30 milliliters. Which of the following diet is prescribed for gastric ulcer? A. Full liquid diet. B. Soft diet. C. Bland diet. D. Clear liquid diet. RL should not be administered for A. Burns. B. Dehydration. C. Renal failure. D. Hypokalemia. Thrombolytic therapy would be appropriate for which of the following conditions? 1. Continual blood pressure above 200 by 120. 2. History of diabetic retinopathy. 3. History of significant kidney disease. 4. Myocardial infarction. For a client who presents with a heart murmur, the nurse can best explain how a murmur manifests in the body by saying: 1. The systolic occurs between S1 and S2. 2. The diastolic occurs between S2 and S1. 3. It is determined by intensity over time. 4 inches. It is a measure of turbulence of blood flow through the valve. Identify which fetal heart rate pattern shows premature rupture of the membranes on the fetal monitoring rhythm strip. 1. Early deceleration. 2. Normal fetal heart rate pattern. 3. Late deceleration. 4. Variable deceleration. The term dizygotic refers to twins who have 1. Developed from 2 ova and 2 sperms. 2. Been born several hours apart from each other. 3. Developed physically at different rates from each other. 4. Developed in one amnion and have one chorion.